This is our lecture number 31, and this is all about testing. We're going to be taking a look at some of the essential features of tests. We'll also be taking a look at some actual personality tests that are very frequently used. Once again, this is not an exhaustive analysis at all of this particular area, which is so important, as we begin to get into the whole area of behavior disorders. But again, we'll give you a representative example of some of the tests that are used. Testing is an area in which there is considerable controversy. And much of it is related to some of the key concepts that are involved in the integrity of tests. And those are things that we're going to be talking about that are really absolutely essential first to understand. So let's begin this by taking a look at first of all, some what I call facts regarding testing, and I've just pulled out a few here because they are controversial. Poor Americans, Black Americans tend to score lower on standardized intelligence tests than rich Americans and white Americans. I mean, that is something that is well known in the field of testing, the field of intelligence testing. Those facts are ones that have led to significant controversy about the overutilization of tests. Secondly, one of the things that we know is that large corporations have designed personality tests and aptitude tests as a way of screening applicants. Who does well, who doesn't do well, and it's used as a basis for employment. It's used as a basis for making decisions about what companies want to do in terms of hiring people. And I'm not so sure that that's a good thing. I think, once again, the utilization of tests, psychological tests, is something that has become pervasive. And I have reservations about how much it is being used. So that's another important fact. Certainly another fact is that when you take a look at certain tests that are used in the area of behavior disorders, psychotic individuals score differently from normal people on many different personality tests, and it's used as a method, and certainly not the only method, but used as a method for making diagnosis. Is there an over-reliance upon these tests for that particular purpose? So again, this is an area that's filled with controversy. It's an area in which we are constantly challenged with both ethical kinds of questions as well as questions that have to do with the reliability and the validity of tests. So let's explore some of these core concepts, the concept of reliability and validity. Reliability, simply put, how consistent are these tests in terms of the results that they produce? And validity, do results of these tests really satisfy their purpose? Do they really satisfy the objectives that testers have? So again, we look at these: the reliability, the stability of scores on a test, the consistency of scores, validity, how well does a test measure what it says that it's measuring, and then lastly, we have this whole idea of norms, comparing an individual score to a standardized group, something that's very essential in the field of testing. So it's these core concepts that you see here that are so important in terms of psychological assessment. Indeed, whether it's a psychological assessment or a test that you take in a class, or any kind of a test, reliability, validity, and the establishment of norms, absolutely crucial. Okay, so we need to have a little bit of background in this. Let's first of all take a look at this concept of reliability, and one way that we have of doing this is called test-retest reliability. If an individual is administered a test, the same test on several different occasions, do they tend to score the same? Another way of trying to achieve this is what we call internal reliability. Let's say there's a personality test that consists of 20 questions. Do all those questions measure the same thing? In other words, are they strongly associated with one another, strongly correlated with one another in terms of what they're measuring? That's called internal reliability. And then we also have what's called interjudge reliability. If you have a person, if you have an essay test, for example, and you have 4 or 5 people scoring that test, do those scorers, do those raters agree on their scoring? In other words, they're doing it all independent of one another, and then we collect their scores. Do they stack up with each other? Are they making similar kinds of critiques and giving similar kinds of scores? This is another way of trying to achieve this whole concept of reliability. So 2 methods of ensuring reliability, again, that are important. Have 2 different people scoring the test independent of each other. For example, some of you may be familiar with what the law board requirements are when you take the law boards in a state. You have to pass the bar exam after you go through law school. Well, part of that test is objective multiple choice, and another part of it is essay. And there's lawyers who serve on these committees on the law board that do the scoring. And they do so independent of each other. And this is, ultimately we take a look at, let's say, 10 lawyers that are scoring these. Are they, giving the same kinds of scores to any particular essay for any particular person? Again, administering a test at 2 different times, this whole test, retest reliability idea. So again, let me pursue this a little bit further and give you an example of what we're talking about here. Let's say that you administered the Stanford Binet IQ test in January of 2010. And this is how the 5 individuals who took it, how they scored. This person was on top with 140. Once again, remember that 100 is the norm. Then another individual, 125. Then yet another individual right at the norm of 100. Then a person 10 points below at 90, and then another person 30 points below the norm of 70. Then we re-administer this same test in January of 2011, and this person who scored the highest now scores 10 points below the norm. This person who also scored high now scores the lowest. This individual who was right at the norm now scores the highest. This individual who was 10 points below the norm shows a jump of 35 IQ points. And this individual who scored 30 points below the norm now scores much higher. So indeed, there's no relationship here between how these individuals are scoring on the 2 separate administrations of the test. So this is a test that has poor reliability. Again, if we saw this with a lot of individuals, we would make this conclusion that there's very poor reliability here. Here's another possible outcome where individuals are scoring the same. And again, if we achieve this, we would say that this is a test that has good reliability, again, to the extent that we saw this in a lot of individuals. So again, retest reliability is a way of trying to assess reliability. The concept of validity is a good deal more difficult to attain. We have things like what we call concurrent validity. Is a test really measuring, what we say that it's measuring? I mean, one of the things that we could do is to administer, for example, two different tests that are measuring the same thing. Maybe it's we're interested in the extent to which an individual is depressed. and we're using what's called the MMPI, the Minnesota Multiphasic Personality Inventory, which we'll quite shortly take a look at. And then we used another depression assessment with a whole different type of personality test. Are we getting the same results? If we are getting the same kind of results on 2, 3, 4, 5 different personality tests, then, you know, we could say quite confidently that we really are measuring, in this case, the degree to which an individual might be suffering from depression. Predictive validity: do scores on a test predict a future event? If we have, let's say we administer a personality test and the individual shows that they are, you know, potentially could become obsessive compulsive in the future, what extent do they in the future become obsessive compulsive in terms of their behavior? So indeed, do scores on a test predict some future event? In this case, do they predict behavior in the future? So we call this predictive validity. And then we also have content validity. Again, taking a look at the questions themselves. Do they really relate to all aspects of what it is that we are trying to measure, whether it's depression or whether it's attitude change or sexual motivation, whatever it may be. Do those questions line up in terms of measuring all different parts of this thing that we're trying to assess? So again, this is the concept of validity, and again, to give you an example of this, let's use 2 different personality inventories. One's called the MMPI, the one's called the CPI, and what we'll do is we will measure the degree to which a person is suffering from anxiety. On this particular scale, on the MMPI, again, we're measuring anxiety. 10 is very high, 1 is low. So here's the distribution that we see of these 5 individuals: 1 very high, 1 very low in terms of anxiety. This 2 is high. This is, you know, an average amount of anxiety. This is relatively low. So that's how they score in the MMPI. But then, let's say several weeks later, we use the Cattell Personality Inventory, also measuring anxiety, and we see that there's really no relationship at all between these two. Those who scored high on anxiety on the MMPI now tend to score low on the CPI. Those that scored very low are now scoring higher on the CPI. So again, we would say that to the extent that we got this with a large number of individuals, that these are not tests that are really measuring anxiety. But if we got this pattern of results where, again, individuals are tending to score the same, then we would be confident that this is, excuse me, that we are in fact measuring anxiety, that these tests are, you know, do possess this characteristic of validity, that they're really measuring what we say that they're measuring. So again, we can have all different degrees of this, where, for example, we could be using like 6 or 8 different personality inventories that are measuring anxiety. And again, to the extent that we get this pattern that we see here, where there's good correspondence between these different tests, this then we would conclude is a very good validity. There's also the whole concept of norms. And again, you have to have a way of assessing the score that you get on a particular test with everyone else who has taken that test. So testers develop these norms. They give a test to a large group of individuals, a very large, very well-defined group, and that's called the standardization group. And in the future, when an individual takes this test, we have that standardization group that their results are going to be compared to. So it's really crucial that that standardization group be one that's representative of the universe of all possible individuals. So again, the whole concept of norms is also crucial to testing, and being able to take individual scores and then comparing them to this group of individuals that previously took this test, a very, very large group of individuals, very well defined, very representative of the universe of all possible individuals. So again, this concept of norms, along with validity and reliability, particularly crucial. So let's take a look at a sampling of some psychological tests. And again, there are many. And you could take an entire course in testing, an advanced course. Indeed, in graduate school, enormous for clinical training, enormous amount of time spent on testing and different types of tests. We're just going to be taking a look at a very small sampling of this, but I think it will help you to understand how these tests were developed and what they actually do assess. So we will take a look at personality inventories, and the primary one, the most popular one, is called the Minnesota Multiphasic Personality Inventory, MMPI. That's the acronym that you will see. And then we'll take a look at what we call projective tests. We'll get into a little bit of a description in terms of what projective tests actually represent. But we'll take a look at three: the sentence completion test, the Rorschach Inkblot test, and also the what's called the Thematic Apperception test, the TAT. So again, this is not an exhaustive examination, but it will, I think, give you a little bit of background in terms of the various types of psychological tests that are used, especially in the field of diagnosis of behavior disorders. So personality inventories, very popular tests. They are very carefully standardized. Typically, they have different scales on them that measure a different aspect of personality. I'll get into a description of that in just a few moments. When you take a personality inventory, you are responding to personal statements, and oftentimes what is required is just a yes/no response to those personal statements. And again, I'll give you some examples of this in just a few moments. So on a single personality inventory, again, we're getting scores on a number of different scales. Each one of those scales is measuring a different aspect, a different dimension of personality. So the MMPI, again, probably the most popular personality inventory in the world. It has been translated into many, many different languages. It was originally created to give a tester a quick way of diagnosing mental disorder. That was how it was originally devised. It has 14 scales on it. 10 of them are designed to assess the degree to which a person suffers from a particular mental disorder. That's 10 of the 14 scales. So how then are these scales developed? Well, let's take a look at an example of one, the Depression Scale. The Diagnostic and Statistical Manual, which we will take a look at when we do get to the whole area of the study of behavior disorders. DSM is like a handbook. It's a guide. It defines different types of behavior disorder and the latest research that's been done, and gives symptoms that one should look for. So the DSM defines what we call pure depression as intense unhappiness, poor morale, lack of hope about the future. I mean, that's the primary defining feature of this. So the creators of this test then took individuals, the patients that had been diagnosed as pure depressed individuals, and that is called our criterion group. Okay, again, all these individuals suffer from severe depression, from clinical depression, pure depression. And then what the testers did was to create 500 test questions, right? And they administered those to the criterion group and to a group of normal subjects. And what they did was, after they got those results, right, the test questions in which these two groups always were different in terms of their responses. That is, the pure depressed individuals, that is the criterion group, always would respond one way, and the normal subjects would always respond the other in the opposite way. Those are the test questions that ultimately were used. So of that 500, then there was probably about 40 or so in which these individuals, that is your depressed individuals and your normal individuals, always gave different responses. So those are the actual test questions then, those 40 questions that are on the depression scale. So every other scale that you see on the MMPI essentially was created in the same way. So let's take a look then at some of the questions, again, not only for the depression scale, but some of the other scales. And again, this question that you see here was one of those 40 that was selected for the MMPI depression scale. And again, depressed subjects always responded yes to this. Normal subjects always responded no. And the question was a simple one. It said, I am frequently unhappy throughout the day and do not wish to have any human contacts. Depressed individuals typically respond yes to this. Normal subjects respond no. Here's another scale, again, developed in the same way, the Hypochondriasis Scale. These individuals, are overly concerned about their health. They have a pattern of complaining about their health. Oftentimes they are fatigued. Here's a sample test item that reveals this. And the question is, I have a great deal of stomach trouble. Those individuals who are hypochondriacal typically respond yes to this, and normal subjects respond no. Here's another scale, Hysteria Scale. We talked a little bit about hysteria in some of our previous lectures, but again, it's these physical symptoms, principally. There's no underlying physiological cause. They're principally used by individuals to get attention, to avoid social responsibility. And the test item, one of the test items of the 40 or so on the MMPI to assess hysteria is, I have had fainting spells. People suffering from hysteria typically do. Normal subjects don't. Here's another scale, the Psychopathic Deviation Scale. Again, these are individuals who show a disregard for social rules. They're very impulsive in their behavior, very self-centered, very narcissistic. They have these very, very shallow relationships. Here's a test item that you see here in which this is revealed. In school, I was sometimes sent to the principal for cutting up. Individuals with this psychopathic deviation typically respond yes to this. Normal subjects typically respond no. Masculinity, femininity scale. How much do you identify with being masculine and masculine sex roles? Or how much do you identify with being feminine and feminine sex roles? Here is a question that's on the MMPI that reveals this. And the question simply is, I enjoy reading love stories. If you identify with feminine sex roles, then you typically respond yes to that. Normal subjects, however, or masculine. Again, you can really tell a lot from this in terms of the degree to which an individual affiliates with either a masculine or a feminine role. And again, this was developed in the same way in which the other scales on this test were developed. The Paranoia Scale. This is, feelings of persecution, feelings of suspiciousness, being very sensitive, blaming other individuals all the time, and engaging in projection. A sample test item that reveals this is this statement: "I am sure I get a raw deal from life." Individuals suffering from paranoia typically respond no. Individuals who are normal typically respond no to this. So indeed, another scale. The Psychasthenia Scale. This is extreme anxiousness, fears that a person has all the time about everything. Guilt, obsessions, and compulsions. Here is a sample test item that reveals it. I feel anxiety about something or someone almost all the time. Individuals that, again, are psychasthenic typically respond yes to this. Normal subjects typically respond no. The Schizophrenia Scale. Again, this is a total shattering of personality. This feelings of confusion and being disoriented, bizarre thoughts, bizarre language. This is all captured within this general category of schizophrenia. The test item that reveals this, one of them, again, roughly 30 or 40 on the MMPI that assess schizophrenia, is I often feel as though things were not real. Again, individuals typically respond yes to that if they have these, if they are at risk of schizophrenia. Normal subjects typically respond no. The Mania Scale: extreme excitement, euphoria, excessive optimism. That's how DSM defines it. Sample test item that reveals it, and again, 30 or 40 that ended up on the Mania Scale on the MMPI. The statement: "At times my thoughts race ahead faster than I could speak them." Individuals who are manic typically respond yes to this. Normal subjects typically respond no. Social introversion scale. These are individuals that are very withdrawn. They're very isolated. They're shy. They're very reserved. The sample test item that reveals this is whenever possible, I avoid being in a crowd. Those suffering from social introversion typically respond yes. Normal subjects typically respond no. So again, this gives you an idea of the scales, some of the scales that we see on the MMPI. So that's the MMPI. What I want to do now is take a look at projective tests. And this is I think, a funny cartoon. This individual, this psychologist is saying, "What do you see?" And this young child says, "An old guy giving a kid a Rorschach test." This is one of the cards on the Rorschach test. So in projective tests, a subject is confronted with something that's vague, and they're asked to try to put some structure into it. So again, there's this unstructured or ambiguous stimuli that they're shown, and they're asked to respond to it. And they can respond to it in any way that they like. The stimuli typically are vague, just as in the case of the Rorschach test, this picture that you see right here, this Inkblot, very vague. So what happens then is people project their own personal characteristics into those responses. So again, these projective tests have that as their foundation, that it's vague stimuli that you're confronted with, it's unstructured, it's ambiguous, and you're asked to respond in terms of what you're reminded of when you see that. So one such test is called the sentence completion test, and an individual is confronted with a series of what are called sentence stems. These are partial sentences. Here are some actual ones. There are many different sentence completion tests, but here are some ones that were taken from a sentence completion test. And usually, there's several hundred items where an individual is asked to respond to them. So again, this is just a sampling. So again, here's the stem, the happiest time, and the subject is asked to complete this in any way they want. My mother, and again, complete it in any way they want. My greatest fear, same thing, complete it any way they want. The future, my father, again, completion in any way they want. My mind, and people. So those are sentence stems. Let's take a look at some reactions, some actual reactions. The happiest time is when I'm doing something well. My mother has always encouraged me. My greatest fear is that I will fail. The future is a challenge. My father is a successful man. My mind is clear and strong. People are fun to be with. This pattern of answers, the interpretation of it, this person is well adjusted. They're strongly oriented toward success in their life. That's the pattern of answer that we would see in a relatively normal individual. But now let's take a look at another pattern. The happiest time is now. My mother is a woman. My greatest fear is yet to come. The future is tomorrow. My father is a businessman. My mind is my brain. People come in all shapes and sizes. This pattern, the interpretation of this pattern is very different. This person is very guarded. This person is very literal minded. They really don't want to reveal anything too significant at all about themselves. So again, this is the sentence completion test. There are many different varieties of this. And again, you can take a whole year-long course in a doctoral program in clinical psychology about how to administer this test and what to look for, what predicts, certain types of problem areas for an individual in terms of behavior disorders. So again, interpreting the test, the answers can be classified as being very positive or very dependent, high level of eroticism in them, or very friendly. The answers can be rated on dimensions of anxiety or hostility as well. The weakness with the sentence completion test is that if skilled enough, a patient can deliberately distort their answers. Okay, and this indeed is something that can occur. Okay, so again, sentence completion test, another popular projective test. Certainly the one that I think most new students of psychology perhaps have some familiarity with is what is called the Rorschach Inkblot test. And here's one of the cards on the Rorschach Inkblot test. This test was one that was created by a European psychiatrist by the name of Hermann Rorschach. And when he developed this test some years ago, it was primarily meant to examine fantasy in a person's life and how they go about perceiving really the world. And now it has evolved to that of psychiatric diagnosis. So again, it's changed in terms of its original intent. But there are 10 cards. They have symmetrical inkblots on them. The patient, the subject, sees the cards one at a time, and again, they are asked what they are reminded of. And the interpretation is based upon a number of things. It's based upon all the research that Hermann Rorschach and others have done on, what patterns of answers predict certain types of behavior disorders. It's based upon psychoanalytic theory. It's also, to an extent, based upon common sense in terms of the answers that are given. So when we take a look then at interpreting the Rorschach Inkblot test, let me give you some common kinds of guidelines and interpretations. If a subject views a card as a whole, instead of just picking out small parts of the card, that is thought to be a very positive thing in terms of how they go about organizing material and their ability to do so. Viewing just small parts of the card, interest in specific things, concrete things, common sense intelligence. Reading in movement, again, if you read in human movement, that is thought to represent a high level of creativity and mental functioning in an individual. Reading in animal movement, that's thought that you have an obsession really with sexual and aggressive behaviors and behaviors that generally society condemns. Reading in movement of non-living objects, that's thought to represent a lot of tension and anxiety and conflict in a person's life. Reading in a popular response, that's thought to indicate that a person exhibits a high level of conformity. Certain patterns of responding reveal certain types of psychopathology. And again, this is all based upon previous research that has been done not only by Rorschach, but by many other individuals who have worked in this area using it and administering it to patients. The last test that we want to talk about is called the Thematic Apperception Test, the TAT. This is one of the cards on the TAT test that an individual is confronted with, and they're asked to tell a story about what they see. Again, series of cards, pictures on each one of them. The subject is simply asked to tell a story about what they see. And what the analyst, the psychologist does is they assume that the main character in that story perhaps represents the storyteller and represents their life, or maybe it represents instead someone that's very close to them. But it does reflect their preoccupations and their wishes and their needs and their concerns. The TAT oftentimes has been used to reveal what we call dominance needs, such as power needs, affiliation needs, achievement needs. When a person evaluates answers in these stories that they tell as being very conscientious, for example, they're generally have lived up to obligations, and their stories are told in a very serious way and in a very orderly way. So again, certain patterns of answers reveal certain types of abnormalities, also reveal whether or not an individual is indeed normal. So indeed, the TAT test, here's a couple of them that I'll show you. Here's one card. This is the way it's typically described by the subject is this girl is sitting on a couch with a doll in her hands, and an older woman sitting behind her is reading to her from a book. And the intention is to bring, of this card, is to bring out whether or not there's any anxiety about mother-child interactions. And the picture is perceived as figures rejecting each other since they're looking away, they're not looking at each other. And it can be portrayed as a mother telling a fairy tale, for example, to her child. So that's one such card. Here's another card that you see here. A young woman that's at the front. This is the young woman here. An older woman in the back, and again she's holding her chin. And the background figure is oftentimes seen as a woman who is evil. Maybe it represents a mother-in-law, for example. The negative qualities are often feelings and attitudes towards her own mother. So indeed, these are some examples, some popular examples of tests that are used in the whole area of testing. So we looked at what are called projective tests, the TAT, sentence completion tests, and the Rorschach, and we also took a look at personality inventories. So again, and the MMPI, and again, this is just a small sampling of the many different tests that are out there. So in our next lecture, we're going to be taking a look at, begin to take a look at the whole area of behavior disorders.